Hi everyone, my name is Alicia and this is my population level health education intervention presentation. The four health education topics that I will focus on are nutrition, obesity, drug abuse, and stress. The background and significance of these topics are relevant to the socioeconomic status of the society. The poverty rate for this community is 17.6%, which directly correlates with how well they manage their nutrition, their stress, and issues with substance abuse. 1 in 12 Californians have diabetes, and 1 in 3 have at least one form of cardiovascular disease. 25% of Californians were obese as of 2016, with Latinos holding the highest obesity rate among other ethnicities. 8.45% of Californians 12 years and older had substance use disorders in 2015 to 2016 data, compared to the total national average of 7.62%. And on a 10-point scale, Americans with a household income of less than $50,000 reported a stress level at 5.1, compared with an American household income greater than $50,000 with stress reported at 4.6. All of these issues and the data collected are relevant to the topics of nutrition, obesity, substance abuse, and stress. Healthy People 2020 objectives. The objective for nutrition is to increase the proportion of Americans who have access to a food retail outlet that sells a variety of foods that are encouraged by the Dietary Guidelines for America. The objective for obesity is to increase the proportion of adults who are at a healthy weight. The objective for drug abuse is to increase the proportions of adolescents never using substances. And the objective for stress is to increase the proportion of employees who have access to workplace programs that prevent or reduce employee stress. I based my needs assessment off of my windshield survey, which involved observing the community members. I noted that many community members were obese or overweight and led sedentary lifestyles in this specific area code. I also observed that there were a lot more people driving in comparison to the amount of people walking around or bicycling or engaging in outdoor activities. I also interviewed both key stakeholders and interviewed community members to determine identifiable needs of this community. The stakeholders identified stress and drug abuse as areas of high concern. And community members identified lack of access to affordable and healthy foods to improve their nutrition. And they also identified lack of resources, time, and safe outdoor locations as barriers to reducing weight. Theoretical framework. The pre-seed-proceed model was used for this project. It allowed me to identify the needs and wants of the community based off of a needs assessment survey that I completed with many members of the community. I was also able to identify barriers to change and factors that influence health status based off of what community members told me and my own observations through my windshield survey. Therefore, I was able to create and implement interventions that I felt addressed these barriers and could help the community members adapt and make changes. The process evaluation helped me take a look at how well I was going about creating all of the information, or identifying and creating how I was going to present the information to my two classes. And then I identified short-term and long-term objectives for the participants in my classes to determine how well they were able to understand the information, and then long-term objectives for follow-ups to see how well my classes, how effective my classes were. The issues I identified were knowledge, adaptability, and resources. The community members can't make any changes without the appropriate knowledge given to them. they needed information on why it was important to make changes, how these changes were going to benefit their lifestyles. They also needed to have interventions that were not out of interventions that they were capable of doing, something that they weren't incapable of carrying out, and something that they could easily adapt to make work for their own lifestyles. And then I was also needed to provide them with the resources to implement these interventions. Nutrition. So the topics I discussed were health problems associated with poor nutrition. These included heart disease, obesity, diabetes, tooth decay, high cholesterol, and high blood pressure. We also talked about methods for reducing healthy food cost. This included using coupons and digital coupons to make couponing easier, meal planning to reduce overspending and to prevent food spoilage, buying generic items instead of brand items, using a list to stay on track and to avoid impulse buys, trying different grocery stores to see where community members could get the best deals or discounts. Also purchasing clearance items, items that were going to expire in a few days but could be used if meals were appropriately planned out. And also the importance of portion control, making enough food for leftovers, but ensuring that people weren't going back for excessive consumption and then not having any leftovers later. We also discussed substitutes for healthier food options, using ground turkey instead of ground beef, using spices instead of salt, using olive oil instead of butter, and using egg whites instead of whole eggs to decrease the intake of fat, cholesterol, and salt in foods. And I also showed the class how to use the MyPlate for food tracking and meal planning. That way they could track their foods, their caloric intake, their daily activity, and they could plan out their meals for the week. This was in line with the Healthy People 2020 goal to increase the proportion of Americans who have access to food retail outlet that sells a variety of foods that are encouraged by the dietary guidelines of Americans. Obesity. The second health topic was obesity. In my class, I discussed health risks associated with obesity, such as heart disease, stroke, diabetes, certain cancers, sleep apnea, osteoarthritis, and gout. We also discussed the benefits of both diet and exercise. Many of the benefits discussed were reduction in the health risks associated with obesity, improved sleep, increased energy, and reduction in stress and depression. I also discussed how to incorporate exercise into lifestyles with limited time and limited resources. I talked about how exercising for just a half hour a day, moderate to intense exercise, was enough to boost metabolism. And for participants who are on time constraints, they're able to take a 30-minute lunch and step away from their office or their work. You can go on walks to pick up food or just walk around the building. And then we also discussed exercises without equipment, as equipment can be expensive. So just exercises using participants' own body weight. And also talked about affordable gyms in the area if community members did have some extra money to spend on a monthly gym membership, and as well as there's a lot of deals on Groupon. So I just discussed that as well. A lot of deals for gym memberships or just a set of classes to take. And all of these interventions were in line with the Healthy People 2020 goal to increase the proportion of adults who are at a healthy weight. Budget. The majority of the cost was for materials and raising awareness about the classes. So I printed out pamphlets for participants in the class, as well as creating poster boards to display the information, as I didn't have a projector, and the location I chose did not have a projector either. And then also raising awareness about the classes through flyers. Those are the two most costly things for these classes. And if the classes are to continue, I feel they should be taught on a volunteer basis. So no one's being paid to taught these classes, but the staff who are going to be teaching them should be knowledgeable on the topics of nutrition and obesity, and should include but not limited to medical professionals. I estimated that the monthly budget would be about $500 for materials and supplies, possibly more if I wanted to upgrade to getting a projector for just to enhance the experience overall. Project evaluation. So my short-term and long-term goals for the class for nutrition were, by the end of the class, at least 75% of the participants would be able to identify techniques that can cut costs of healthy foods. At least 75% of participants would be able to identify methods for substituting healthier options into meals. And at least 75% of participants would be able to explain how to use MyPlate for food tracking and meal planning. For obesity, my short-term goals were that at least 75% of participants would be able to identify at least two negative health outcomes associated with obesity. At least 75% of participants would be able to identify the health benefits of diet and exercise. And at least 75% of participants will be able to explain how they can incorporate exercising into their lifestyle with available time and resources. The short-term objectives were measured by using both a teach-back method, asking questions to assess how much information the participants actually took in and understood, as well as a short quiz at the end of the class to determine how effective it was. I felt long-term objectives could be measured by doing follow-up surveys every 6 months to see how much people had implemented my interventions into their daily lifestyles. Results and conclusions. Community members were educated on the importance of nutrition and maintaining a healthy weight, along with methods to achieve both. Weaknesses, definitely difficulty attracting the community members to attend the class. I felt I had limited time to create enough flyers or come up with other interventions to raise awareness about the class. Going forward, I would want to come up with another way to attract attention other than just creating flyers. Another weakness was definitely language barriers. One of my goals for the information was to have information available in another language, preferably Spanish, as a lot of the community members are Latino. But I did not have enough time to get someone to help me with accurate translations that were going to be understood. So I didn't want to provide participants with incorrect information or information that didn't make sense. Going forward, if I were to continue teaching these classes, I would definitely want to have this information available in Spanish as well as English, just so community members have the different options for getting this information in languages they feel comfortable. And I taught this class primarily using pamphlets that I handed out as well as poster boards, but I feel that going forward, using both pamphlets and a projector would be best, as the information is better displayed and organized and can be better read. And here are my references.